Let's begin with the first section of our lecture, and in this we will discuss the different terminologies used and also the mechanism of snoring and what are the different causes of snoring. First, what is snoring? Snoring is an undesirable, disturbing sound that occurs during the sleep. And some people, they snore really loud and they don't even know that they are snoring that loud. So it's very, very undesirable, disturbing sound. Usually the people who are sleeping next to the person who snore and snore loud, usually it's very, very uncomfortable, and that causes sleepless for the other person sleeping next to the person who snore. So it's very undesirable, disturbing sound that occurs during the sleep. 25% of adult males, they snore, and 15% of female. So the incidence of snoring is more in males as compared to females. Prevalence of snoring, it increases with age. So as the age increases or the person get older, usually the snoring increases or the sound is increased. Different terminologies we can use. Sleep apnea is absence of the breathing during the sleep. So it's a spell of absent breathing, sleep apnea. Hypopnoea is another term used. Hypo is low. Nea is the term used for the breathing. So hypopnoea, P is silent in this nea sometimes, but sometimes in some words we pronounce like tachypnea. It's not tachypnea, it's tachypnea, means fast breathing. Bradypnea, slow breathing. But when we say here dyspnea, in dyspnea we don't say P is nea, P is silent. So different ways of pronouncing this word, and it's the nea which is the breathing. So hypopnea is low breathing. Apnea, complete cessation, and hypo is low. Respiratory disturbance index. Arousal means wakening up from the sleep, arousal. Arousal index, sleep efficiency, and multiple sleep latency test or NAP study. So these are different terminologies used. Multiple sleep latency test, what are the latency period, how often the person sleep or they nap. So all that is, these are the different terminologies related to these sleep disorders. Now, what's the mechanism of snoring? Usually the airway that becomes blocked or the obstruction, airway obstruction can lead to the process of snoring. So here before the mouth is open, now here you can see the soft palate, constricted airway, and it is closed. So airway is closed when the mouth is open. So when the person during the sleep opens the mouth and breathe with the open mouth, what happens? The soft palate now cause obstruction of the airway, and that obstruction can lead to the mechanism of snoring, and patient snore. Then person snore, not the patient, but person who has the habit of snoring, they start snoring. Afterwards, when the mouth is closed, now the jaw is forward. Here, if my mouth is closed, jaw is forward, and this forward jaw opens the airway and the person breathes smoothly. But when I open the mouth, this is blocking my airway and cause obstruction. Causes of snoring we have in children. the adenotonsillar hypertrophy, adenoid swelling and tonsil swelling when they cause. We talked about most of these conditions in detail in our previous lectures. So if the adenoids are hypertrophied or there is tonsillar hypertrophy, what happens, they block or they cause obstruction of the airway, and that can cause snoring. And it's very common in children. So in children, it's one common cause. In adults, septal deviation, DNS, deviated nasal septum, again that cause obstruction of the airway. Turbinate hypertrophy in the nose, nasal valve collapse, nasal polypi or tumor, and all these causes, if you notice one by one, the main cause of causing the snoring is the obstruction, nasal obstruction, respiratory tract obstruction. Elongated soft palate and uvula, again causing obstruction. Tonsillar enlargement, macroglossia, big tongue. Macro is big, glossia is tongue. Big tongue also is causing obstruction. Retrognathia, if backward jaw. Gnathia is for the jaw. If the jaw is retro, backward, again that position is causing obstruction. Base of the tongue, if it's large, can cause obstruction. Laryngeal stenosis, narrowing of the larynx. Laryngeal stenosis is also the cause of stridor. Omega-shaped epiglottis. Then some other causes, if the person is overweight, they can have a habit of snoring. Hick neck with collar size exceeding 42 centimeter, and alcohol, sedatives and hypnotics, usually they make the person go to deep sleep, and that can, so all these drugs, alcohol, hypnotics, sedatives, they can also cause snoring. So many different factors that can make the patient or the person snore, and snoring is more in males as compared to females. 25% of males snore, 15% of females snore, and the causes, we talked about so many different causes, mainly leading to the obstruction and causing the person to snore. So that was all about section 1. Thank you for watching sqadia.com.